People with Parkinson's disease have a higher, like, for example, higher levels of plasma circulating inflammatory cytokines in their plasma.
Yeah, so there's some data. I mean, interestingly, there are hints here and there. It's, again, not as well worked out as, MS, for example. Mm-hmm. But yeah, the idea that there's, TNF alpha, IL-6, so the idea that there may be higher pro-inflammatory cytokines, and that's something that we're going to try to explore in some of the work that we're doing right now. So people do believe that, again, it may not be the cause of Parkinson's, but maybe something that's adding to the progression, which is things like inflammation, what role diet, the microbiome, I mean, they all start tying together there, that may play as a mechanism is going to be important and something that definitely needs to be investigated further. So again, another place where we may be able to modulate the disorder.
Yeah, but right now it seems as though the thing that's pretty repeatable is the exercise. And,
yeah.
Mm-hmm. And that's, do you tell them 3 times a week?
Yeah, I mean, we basically, most of the studies are about 3 times a week. So I would say about 3 times a week, minimally 30 minutes, 3 times a week, and trying to make it as intense as possible. Yeah, and then we add that as part of that should also have some skill component, particularly involving gait and balance related task, and there's a lot of things that do that. So I don't pick out any one in particular. I don't, whether that's Tai Chi, yoga, surfing, whatever they like to do. Yeah. I think that's important as well. And I think, as you pointed out before, having someone to give you the feedback so that you're accurate and challenging yourself is actually quite important. So I think having that one-on-one, particularly in Parkinson's, is a smart thing, and we do try to get people into some one-on-one therapy. I usually do at least 2 times a year, and actually I start right away. And there isn't anybody that I don't send, because we can always make it challenging for you.
I think absolutely that's really key. I think that having someone there that's going to really help push you past your comfort zone, give you that feedback.
Yeah.
I just it's really important for people, particularly people that are less prone to push themselves. Like I'm one of those people that I'm pushing myself. I want to be the hardest working girl in my spin class. Like I'm like, that's
right.
But I'm also, I don't have these neurological problems and apathy and all this other stuff that comes along with Parkinson's disease. And I've been younger, and this is sort of my personality. So getting someone to do that, push themselves, it's so key. Oftentimes, I might say to someone, exercise is really important. They're like, well, I walk my dog. And
yes, I hear that a lot around here. I know.
I walk my dog. Well, that's good. Right. But you're red in the face and sweating. Are you pushing yourself? Are you running with your dog? Are you running with your dog?
Right. So, exactly. I mean, you got to be tough. You got to be a little tough. And anyway, I try to be pretty tough. But also, like I said, there isn't anybody. I don't care if they're even been in a wheelchair. I'll try to get them up. We'll see what we can do. I'm not, we do everything safely, but I think that I'm so passionate about that because, when I was in the field, it's been a while, obviously, but, I was in the field at a time where exercise was not thought like that. In fact, it was pretty much thought it couldn't do anything. And so patients with Parkinson's disease, we may give them a wheelchair or a walker, but there was no plan to make it hard. And I think that's the thing in general. I think people kind of feel like, as you're getting older, just chill and don't do anything. And it's like, no.
People are afraid of falling. They're afraid.
No, I think it's this idea that somehow you can't gain something from, or you just can't do it. I'm not sure. But so forget that. Yeah, no, everyone is.
Do you see improvements like with your people that have more severe? They're more.
Everybody gets better. I mean, we see improvement in everybody. I think that's the thing. And even small gains are good gains. I mean, so and I like them to mix it up by I'll tell them to play instruments even to get more hand skill going. And I think that's the thing. We are, in a way, we're too easy on each other. And as people get older, it's like, get out there and learn something. Go out there and learn a new skill. Take up racquetball. I mean,
are there like, is this a common for clinicians in the Parkinson's field? Are they commonly emphasizing exercise? Do you know? Is this like something that's been more embraced, or do we have to push it more?
In general, it's been more embraced, but I have to say, in general, I mean, I'm very.
Well, you do research
I'm
on
harsh.
it.
I'm harsh.
You've got the data.
I don't let anybody get away with not talking to patients about lifestyle. And I think the data is pretty clear. And this is not just Parkinson's. 50% of any neurological disorder is lifestyle. And I'm very on it. I tell everybody, I tell all my residents, whenever I'm educating people or whatever, going around with rounds, 50% of any discussion of treatment has to be lifestyle. And if you're not doing that, you're not giving a fair balance of what we really know. And so, yeah, I think that message loud and clear, and there's no excuse anymore.
And it's never too late. It's never too late.
Never too late.